Welcome to the celebration of the International Nurses Day 2023. The topic that we are going to discuss is human resources in nursing to care for population living in conditions of vulnerability in the region of the Americas, availability, capacity, and regulation. To give our opening remarks, we invite Dr. Jarbas Barbosa, Director of PAHO, Pan American Health Organization, World Health Organization. Dr. Jarbas, please, the floor is yours.
Thank you, Sylvia. Good afternoon. Let me start in Spanish. Buenas tardes.
Good afternoon, distinguished panelists, distinguished officials, representatives from Johns Hopkins University, and all those present in this seminary, in this meeting, in person or virtually. I'd like to send you my greetings and to address my gratitude on behalf of the Pan American Health Organization, PAHO, and thank you for your participation in today's event, celebrating the International Nurses Day 2023. The COVID-19 pandemic has had a significant impact on health, on life, and conditions for the development of countries in the region of the Americas. It has brought to bear and brought structural challenges that affect health systems and have affected the capacity to respond and the results in public health by deepening the inequities that we have in the region. As the pandemic evolved, we saw the need for transforming health systems by investing in systems based on primary health care, focused on people and communities, most resilience, and going back to the health towards universal health in the Americas. It is now high time to apply the lessons learned during the pandemic and to confront energetically our vulnerabilities so that we can be better prepared in order to face new threats as these emerge. The labor force in health in the region played an essential role in the response to the pandemic, and it continues supporting the development of health systems, even though it continues to face challenges related to the scarcity, the shortage, the distribution of personnel, and inadequate work environments. Nursing professionals are an essential pillar of health systems, representing 56% of the labor force in our region. They play a key role in the provision of integrated health services, in managing these services, and in the training of new professionals. In the current global situation, nurses ought to respond effectively and efficiently to current threats and demands of the population, in recovering the lost achievements in public health and improving the quality of the care, and in the development of health systems that will be more resilient. These challenges can be turned into opportunities to transform the labor force in nursing, from the training, the capacity building, and the performance of our work. And now I'll switch to English.
We must urgently consolidate and improve financing in health, including for the training and retention of our nursing workforce. Investments need to be directed primarily at increasing employment opportunities and improving working conditions for health workers within primary health care and the hospital setting, as well as for our public health specialists. Second, the quality of education in the Americas needs to improve. We need to ensure our future nurses are fit for purpose, are well trained in public health, as well as in health service provision, and have the opportunity for continuing education to address the comprehensive needs of the population. We also need to address a critical problem that has emerged more recently with our health workforce, namely vaccine hesitancy. And finally, let us work collectively to expand the professional role of nurses in primary health care with adequate regulation and formal education so we can address critical gaps in service coverage and access to health throughout the Americas. The models of care in remote, rural, and underserved areas in primary health care need to evolve, leveraging innovations in digital technology and in health workforce policy and nursing. On this International Nurses Day, let me thank our nursing professionals for their continued dedication and effort, and for the most important work they do. And let us join efforts to work together to recover stronger and better from the COVID-19 pandemic, and make the necessary investments for the development of the health workforce throughout the region of the Americas. Thank you very much, and congratulations for this very important International Day.
Thank you, Dr. Jarbas Barbosa. It's a pleasure to have you with us. Now I would like to invite Dr. Sarah Zenton, the Dean of Johns Hopkins University School of Nursing, and to enjoy this time to thank you again for having us in your house. Thank you.
Thank you so much, and thanks everyone for coming in person. Thank you for everyone who's online joining us, and happy International Nurses Day. It's a great day, and I'm honored to be with each of you. Thank you. Some of you have come from a very far distance, and we appreciate you coming to our beautiful new home. So nurses are change agents. We're at the heart of every part of the healthcare system. We help individuals and communities. We do research, we teach, we show up, we bind things together. We're the glue, we're the pillars, we're the oxygen. We are at the center of all about healthcare. And nurses have really underused their voices and their platform for policy formation and for change. But we hope at Johns Hopkins, and we hope in collaboration with PAHO, that we can work together to change the health of our nation, our nations, the globe, and everybody, partly with nursing leadership. And policy is a key avenue to doing that. And nurses traditionally have not ended up in policy roles. We are changing that partly by having policy honors program where our own students, and we have some of them here, are matched with faculty members to do policy projects. We've always done research projects and education projects, but now we ask, what is next? How do we change the next thing? What are we learning? And what does it take to change? And sometimes nurses think, oh, policy is for somebody else, and somebody else is going to fix that. But we are somebody else. We are the somebody else's. And policy can be where you work. It can be in a clinic or a hospital. It can be the policy of a state or a whole government or the WHO, right? Policy is everywhere. And we are intent on not only graduating our students ready to change whatever context they're in, but to lead others so that in general, nurses go into nursing, not just to help people, which is so important, but also to try to change the circumstances for themselves and other people. It's about patients and people, the education, the environment, the economy, climate change. All of our big global problems come down to people and actions and health. And so there's so many ways of addressing this, but we need nursing in these policy conversations. And we don't always think of ourselves as leaders, but that's partly a mindset that we need to change, and then a skill set that we need to develop of strategic communication, understanding what policy levers to pull, understanding how to, we are great at relationships with patients. We need to also get great at relationships with policymakers and become policymakers. So I welcome you here. I hope that you'll have great insights and a wonderful dialogue. And the way I see it, we're just at the beginning of a whole decade of nurses leading change. So welcome.
We have a video for the Johns Hopkins University. So if we can have the video right now.
From the streets of Baltimore to cities and countries across the globe, Johns Hopkins nurses improve the lives and health of individuals, families, and communities. Since our founding, we have answered the call to help, heal, and lead. Our researchers are experts in social justice, cardiovascular disease, violence prevention, aging, and more. We are leaders in ethics, health entrepreneurship, mental health, and simulation. Johns Hopkins nurses are communicators and the trusted voice of wisdom and support. We are connectors and exemplify how diversity leads to better health outcomes. When life begins, we are there. When life ends, we are there. And when people go through the highs and lows of life, we lead with knowledge, compassion, skill, and science. At the Johns Hopkins School of Nursing, we impact policy, we speak out on Capitol Hill, and we defy convention. We look at health in the way it's lived every day, and we partner with people to achieve their goals and the goals of their communities. We are leaders. We are change agents. We are advocates. We are Johns Hopkins nurses.
Excellent, excellent video. Now it's my pleasure to invite Bruno Guimarães, Director of the Department of Health Work Management and Regulation, Ministry of Health of Brazil, to talk to us about the availability, capacity of nurses to care for populations living in conditions of vulnerability. Bruno, please. We are going to switch to Portuguese.
Olá, boa tarde a todos.
Hello, good afternoon to all. It is a pleasure and an honor to be here talking on this Nurses Week, talking on behalf of Brazil and our colleagues, and together with PAHO, which is our partner in our Brazilian health system. I would like to start saying that there's an investment in Brazil in this agenda, which is to discuss the availability, capacity, and regulation of nurses in Brazil. In this context, we chose to start a presentation with a characterization of the situation in Brazil, the nursing workforce, so that you have a context for our discussion.
Obrigado. Bom, aí a gente trouxe uma frase para iniciar essa
This quote from Rosa Luxemburg: "For a world where we are socially equal, humanly different, and totally free, this is our aim." We wish for health workers to find a space where they have the right conditions to do a work of quality, and their work should generate happiness because most of our time in life, we are in the world of work. To talk about availability and capacity of nurses to attend to vulnerable and neglected populations is always a challenge. If we consider a country like Brazil, there is a significant number of people who live in vulnerable situations. Our social forming, the design of the Brazilian society is based on various issues that I will present and which have as a result this component of vulnerability, which is a very important one. The first question we ask is who and where is the vulnerable and neglected population in Brazil? I brought some data which show you the dimension of Brazil. It is a continental country. We have 26 states plus the capital, over 5,500 municipalities, and we have a total population of over 200 million inhabitants with a human development index of 0.75. This is a rather healthy piece of data because on the two states that are marked, the differences are very, very different. These are the two extremes. On the Northwest, we have a state with 582,000 inhabitants, and in the South, over 46 million inhabitants. This illustrates the differences, the deep differences that we have in the country. Another issue that we have here, which is very important for our policies and reflects on the labor class, is the variable race slash color. Most of the population in Brazil self-declares itself as either black or brown. We have therefore to think of policies where the agenda of race and color goes through everything, crosses over everything. As far as sex is concerned, we have a majority of women, as you can see here, and this is also expressed in the nursing profession. It's mostly women nurses, so it is a matter of gender as well that has to cross all the discussions about this profession. Another question is to understand what kind of vulnerability are we talking about, because each place has a different kind of vulnerability. In the case of Brazil, some of the groups that are especially vulnerable in terms of their citizenship rights, and this has an impact on the analysis of health versus disease, living conditions of the population, and also the concept of vulnerability precedes the concept of risk, and this can lead to the risk of getting infected, getting sick, and die. So to look at Brazil, we have to look at social inequalities, which means that policies have to take into account this set of characteristics
organizam o país, né?
that organize, so to speak, the country. I wanted to show you what we call the social vulnerability index, which the articulation of several dimensions that expose people to a greater risk of vulnerability. We have urban infrastructure, waste collection, the time it takes between work and a home, uh, child mortality, young mothers with children who are out of school. So this dimension, income, work, has also an important role to play in our calculations. A family that has an income that depends on older people, people who are out of work. This gives us an index which teaches us that looking at a map of Brazil, where in red are the most vulnerable, and here the north region where the Amazon forest is and the northeast are the regions that are most vulnerable, which means that policies have to consider these local situations of the people who live in the country. If we look at municipalities and the most vulnerable and poorest, this corresponds to that map, and the north and northeast are most vulnerable and the least vulnerable in the south of the country, which shows that to look at vulnerability means to look at the places where vulnerability is exposed. Number three, which population groups are historically neglected in Brazil? And here we have some groups that are a robust agenda of social policies, especially the ones of the new government headed by President Lula. We have the homeless population, collectors of recyclable materials, people who live near landfills, mainly sanitary dumps. In rural areas, we have traditional populations from the rural areas, the quilombolas, who are the heirs of the indigenous and Black populations and slaves. And we have women farmers and fisher women. We have the indigenous populations, the populations dedicated to production just for their subsistence. And these are the populations are the ones that are the focus of the public policies. We also have the unprotected, the prison population, the people who live in institutions, in public institutions. Therefore, we think in terms of this perspective and concentrate on the places where these people live. It's important to consider three elements key that explain the genesis of this process: class, race, and gender. These are words that are at the base of this social inequality in the country. It is structured through the capitalist system, but if we look at Brazilian history, there is the genocide of the indigenous population. There is slavery. We had over 300 years of slavery, and this still shows the marks of this situation, patriarchy, and these are issues that need to be discussed in order to understand how policies are formulated for the population. We have structural racism. It crosses the whole production of our health provision system, sexism, gender inequality, income concentration. These are all problems which the country is facing. These are not new problems. These are historic problems for the social conformation of the country. Vulnerability has two important variables. First of all, the structure of opportunities for those exposed and the local capacities to provide such opportunities. When we think of opportunities, we have the market, society, and the state. The market is the space that structures the places where people live. Society makes up social capital, and we have the reciprocity principle among people. And all of this is based on the set of policies that the state has to provide for the well-being of the situation. These are elements, once articulated, help us understand vulnerability in Brazil.
However, not only of the terrible things we live, we are a country with several problems, but we have a lot of hope. In Brazil, considering hope as an active and political act, we created this verb, it's called esperança, meaning there it comes back from a famous educator from Brazil that was named Paulo Freire. So the verb find hope, it is established through the 1988 Constitution. So Brazil, coming from a military dictatorship, were able to reestablish democracy. This process of establishing democracy will allow us that we could have in our citizenship charter in the Federal Constitution of Brazil of 1988 to include health as a right of everyone and a duty for the state. This is a great progress because now everyone in Brazil has right to have a health care. And this is a very important issue for us. And we try to understand this, that our universal system of health, it is one of the major public policy of the world, actually very relevant, and we defend it because we believe that citizenship we create with a social agenda, a robust one, and that's Brazil has been doing, especially in the new, this last administration we are trying to complement. So the SUS, the unique system of health, it's based with a social component of including social assistance, health, and social security, creating its own concept. So SUS, it is a system now that articulates based on an analysis of socioeconomic, cultural, and environmental of the population, considering that those social determinants of the policies, it also incorporate a broader concept of health, understanding it as a well-being, physical, social, spiritual, and mentally then integrated. It will help us to have a dignified health system. And within this context, it's important that we have health workers, because SUS is only available when we have a group of health workers that can optimize it. So within that concept, looking about the health workers in Brazil and considering this demographic cohort, we are around 3 million work professionals. So saying that 72% are women. Moreover, we have around 4 million positions, meaning to say that we have a huge amount of job opportunities in the health sector. So it's very important to understand that to find the nursing workforce in Brazil, it is very relevant because the nursing system in Brazil, it is the largest workforce in the health system in the country. And here, as you can see, the nursing system is located in terms of numbers and understanding the nursing in Brazil. It we call a nursing team, being the nurse technician, but also the assistants and also the midwife. This is the group of health workers that correspond to this very solid number of nursings in Brazil. Around now, we have around 2,373,000 nurses working, exercising 1,222,000, and jobs available, we have almost 1,500,000. thinking about the number of those that are working in exercise, it's important to understand that this cohort, 71% are with a technical college, if you will, and 85% corresponds to those who have a university degree. Considering and fine-tuning this situation, it's important to understand that SUS is the larger employer of health workers in Brazil. In this context, for the nurses, it's the same, where the public health will have around 776,000 of the nurses working. Those that philanthropic, over a lot of them provide service to the SUS. We have 370,000, and the private that are not part of SUS, we have around 175,000 people. So adding up those that work in the public sector, and we have around 1,207,000 health professionals, nurse professionals within that reality. So it's clear that the importance of the strategic role of nurses, because they provide the access to health. We need nurses that are aware of the role so that the health can be provided. And also we try to provide a health care, ensuring a humanized care, ensuring the health equity and integrity, this safeguarding the principle of SUS, they're in the professional practice. So it is important to reiterate that one of the main goals is to safeguard the principle of SUS, and we're talking about quality, integrality, and there are other principles where the SUS must be closed for those that need their health. So we are talking about decentralization, social control. These are other principles that are very relevant for SUS. Health workers and nurses, they must recognize the needs and singularities of the individuals, of the patients, because we are indeed different. We have different needs. So it's important to think that the nurses, they are qualifying the management of the work process, because nurses, it is indeed the profession that provides the continuity of treatment. And within this scope has a very important role that the care, it is humane and decent for the people in Brazil. And also nursing, it has a main goals to promote teamwork and based on the permanent education process, safeguarding the user when we discuss our practices. And concluding, it is also important that the nursing must be able to safeguard the user as the main protagonist of its own health production. We need to invert the paradigm to see that the need of the user, that's what is going to mobilize that the health process must be structured and not the other way around. To conclude, we have several challenges. In terms of the health reality, I believe it's not only in Brazil, but it's a challenge that several countries are facing, is the expansion of primary care coverage, qualifying those health workers, understanding as well the main role that the user will have entry and qualified ability of healthcare, integration of the healthcare. So the primary care coverage must be able to create a dialogue with the specialized care. And this is very important that we'll be able to establish that through the articulation or reference within the health system. Also important that we consider the nursing workforce establishing planning, that the appropriate distribution with a appropriate profile that we can ensure the quality and health system, not exposing the profession, the health professions to any kind of risk, so they'll be able to get any kind of disease and end up dying. We should also qualify the nursing education in Brazil, giving, improving the process, the decent, dignified, establishing as well the considering the needs of the health system, regulating the training, the professional practice and labor relation, another very important topic, trying to provide security and safety to these nursing workers. So avoiding prevent factors that can increase the risk of mental disease, especially after the COVID-19, especially those who are on the front line, working and thinking, trying to provide health quality in the workforce. So because of that, Brazil is trying to establish a new nursing salary floor. So we can discuss what the world has been already doing to advance nursing practices, but in a more sustainable way, including the other protagonists, social professionals, trying to understand the possibility that we can have a sustainable process able to discuss the practical scope of all the nursing workers. We are trying to invest in being able to understand what the workforce need, the demography of the nursing workforce, and a path, a career path, establishing a program to integrate the health professionals with clear strategies in terms of mental health, and also trying to create or retake the democratic spaces that lately in Brazil has been terribly affected, and we need to create a new dialogue within the country so people can understand that democracy is indeed a system very valuable for the whole population. Concluding, again, we must rethink permanent health education policy, thinking about the legacy and lessons learned from the COVID-19 pandemic, and that enable us to reestablish the workforce, including in our agenda, how we should value or expanding the scope of graduation and post-graduation, including new curricula and including as well other institutional actors. I brought you here this sentence it seems to be everything is very difficult to realize, because a few years ago, we said that it was very topic to have that kind of health system that will be able to provide the health for everybody. Now it's a reality. Eduardo Galeano, he helps us when he says, utopia is in the horizon. Get 2 steps closer. It moves 2 steps further away. I walk 10 steps and the horizon runs steps away. No matter how far I walk, I will never reach it. What is utopia good for? Is it for this? So that I will never stop walking. Let us all continue walking to strengthen nursing in Brazil and in the world. Thank you so much.
Thank you, Bruno Guimarães. And you can see the several claps for your presentation. So everybody is applauding you. Thank you. Now I would like to invite Gabriel Muntabski. Gabriel Muntabski is the National Coordinator of the National Nursing Education Program, Ministry of Education in Argentina, and he's going to talk to us about nursing education and development in Argentina.
Okay. Buenos días a todos y todas.
Good morning to everyone. Happy International Day of Nursing to all. For those of you who are nurses or those who will become nurses, nursing students, and also those who teach nursing. I'm very honored to have been invited by the Pan American Health Organization to be here today. I thank the Johns Hopkins School of Nursing for hosting us. I will be speaking on behalf of Argentina's Ministry of Health. I will be telling you how nursing has changed in Argentina over the past 12 years. I will start by saying that nursing is the backbone of the healthcare system. Nursing is the main tool and the most important tool we have to effect changes in the quality of healthcare systems. Nursing is the most important vehicle to ensure that healthcare is safer for patients and also for healthcare professionals. So I will start with that introduction and tell you that since 2011, Argentina, we had 155,388 nurses, of which 9.5 were registered nurses, having had 5 years of training, 36,000 or 36.46% were technical staff and 54.48% were auxiliary nurses who had been trained for 9 months. The qualified nurses numbered 18.8 per 10,000. So our nursing workforce was not only insufficient in numbers, it was also not sufficiently qualified. So within the framework of the PAHO WHO strategic objectives for the millennium, the Ministry of Health and Education of Argentina decided to establish a public policy for training in nursing. The idea was to train nursing professionals in Argentina. And we decided to do this working on 3 pillars: investment, education management, and regulation. Both ministries work jointly with institutions that train nurses. So the first public policy I will be telling you about is regulation. First, we established the National Advisory Committee on Nursing, and this is important because all of the nursing associations became members of this advisory committee. So we had academic organizations, unions, we had professional associations, federal nursing associations, all worked together to define the frames of reference for education in Argentina. Frame of reference is what you use to compare all curricula across the country with a standard to establish the minimum requirements for training. Also, university nursing careers were included in the university accreditation system, and standards were developed for accreditation of universities. In addition, as a matter of policy, the title of nursing assistant was removed from the national certification system. Then, as far as education management, we focused primarily on training of trainers. One thing we had realized was the lack of teachers, and this is key. As PAHO has said, it's important to train teachers in new education formats, clinical simulation, for example, virtual, remote education, new teaching tools to change the way nursing is taught. We have trained leaders in the education sector on how to retain students. We found that in some schools, 70% of students who began their training dropped out. So it became a challenge to establish institutional policies that included management, teachers, and students, so to remedy this situation. One important element was the introduction of clinical simulation in university curricula. This is a model way to teach our students differently. It is an ethical imperative because people like us are training individuals who are going to be providing care. It is important for our students to be able to practice on standardized patients or with we need to make sure that we set objectives and also work on the planning and evaluation of practices in given healthcare sectors. This is where students come into contact with patients. This is where they learn the reality of the system. And this is the place that makes the biggest difference when it comes to nursing training. Then we have the public policy on investment. More than 15 new public universities have been established with nursing programs. They all have clinical simulation equipment, and I'll explain this further. New teaching positions were added to higher technical schools and also universities, and policies were established to promote equal opportunities. Our nursing students in Argentina are typically women between the ages of, or at least 24 years old. They come from humble origins and are also frequently mothers. They therefore need the government support to complete their studies. So as an investment policy, all public institutions for the training of nurses have been equipped with clinical simulation devices. They all now have simulation centers and have medium or low, medium, and high fidelity equipment. In addition to that, this year we will be completing an initiative that will provide all nursing students with a technical backpack, which includes 25 tools they need to practice their profession. As you can see here, stethoscope, pulse meter, also have different devices, surgical devices, and everything they need so that there is no difference between those who have and those who have not when it comes to doing their practical training. This year, we're providing 30,000 technical backpacks to all second-year students in the country. Furthermore, as I mentioned, our students come primarily from low-income households. So it's important to have a scholarship program. Currently, 63% of all nursing students in Argentina receive scholarships from the Ministry of Education. So of the 250,000 students we currently have, 90,000 are studying with scholarships. It is the largest scholarship program in the Americas and possibly in the world when it comes to nursing students. Annual investment by the government of Argentina in nursing students is close to $70 million per year. And this is only focusing on what I've mentioned. And this is in addition to everything the provinces themselves do in working with their schools of nursing. In addition, when it comes to regulations, Argentina has recently approved Law 27712, which is the law for the promotion of nursing training and development. It declares nursing training as a matter of public interest. So now in Argentina, nursing training is a matter of public interest. One of the most important things with laws like this is that it establishes rights. And when there is a right, any individual can demand that their rights be observed. So any nurse in Argentina can request that their rights be respected according to this law. It also makes undergraduate, graduate, continuing education, and additional training. It makes fellowships or scholarships mandatory. It also establishes a commission to develop professional careers that make sure that those who receive additional training are also paid more, that they have better salaries. This has to be an indicator because it is what provides incentives to continue training. A better trained workforce, nursing workforce, has to be paid better because it will be providing more quality care to patients. It also establishes 3 years as a minimum nursing assistants will no longer be allowed in Argentina. Every nursing student has to be trained for 3 years. Both houses of Argentina's Congress voted this law unanimously, it approved it unanimously, 300 to 0, 81 to 0. So there was full consensus in Argentina's political community in favor of this law. So this is what we have done through public policy. I'd like to show you the results. From 2011 to 2022, enrollment in nursing schools increased by 311%. The number of new students increased by 313%. So in contrast, higher education in Argentina, which grew quite a bit, grew at a rate of 100%. To give you a reference point, so enrollment in nursing schools increased 3 times more than enrollment in any other higher education field. More importantly, graduates increased by 244%. So we more than doubled the number of graduates entering our workforce. So what did this mean for the workforce? Obviously, it does have an impact. And what I can say is that the changes in the workforce, which you may recall was 155,000 nurses through the Strategic Nursing Training Program, which began in 2011, and the framework, which I mentioned, which improved quality in different sectors and programs. So in 2015, we established the University Accreditation Program. This is slower than I thought. 2016, we have the program, which is the National Program for Training of Nurses, created the video simulation program, which provided all universities with clinical simulation equipment, also began to work on the law on nursing training, and what you cannot see below, it says that we're giving students scholarships and backpaps, and created the law on clinical simulation, which covers 55 universities with 133 courses plus 276 higher nursing institutes as part of a network working with clinical simulation. So if you look at the green line, these are the nursing technicians. They increased by 241%. Thanks to the policy, we saw a decrease of 21% in auxiliaries and an increase of 301% in registered nurses. So if we look at the numbers, what we see is if we compare the 2011 numbers with the 2021 numbers, which are the most recent, we have seen an increase. We now have 90,000 more nurses. Before, we went from 33% of technical nurses, and now we have 56%. Auxiliaries went from 54% to 27% of the total workforce. So we have changed the number and profile of nursing in Argentina over a 12-year time period. Many ask us how we were able to do this. How was it possible? I'd like to take 2 minutes. Do I still have 2 minutes left? I have 5 minutes. Okay, so that's plenty of time. So there's a social consensus in Argentina, as I believe there is around the world. We all believe that nursing is important and it's dear to the Argentine society. So all the love, all the care nurses give their patients come back to them and their profession. This is a very powerful tool. Now we need to channel it and focus it in a positive way through public policy. So nursing associations have a pivotal role to play. It is their job to channel the connection between the different nursing associations with society and with the government. So in that key role played by our nursing associations requires that they work with the government. The government is the place where all political forces debate and where public policies are made. So society working together with nursing associations must build a state policy consensus. What is a state policy? It's a policy that will outlive any administration. As I said, our national policy for nursing has spanned more than 12 years. different presidents, different administrations, different ministers of health, and the policy stands because there's basic agreement that there is a policy that has to stand the test of time. If we change it every 4 years, we are never going to achieve our goals. So one thing for those who are working on this in different places and different countries who may be listening to us, people ask us, how do we convince decision makers? How do we bring them on board? I think decision makers can be convinced if you show them results, but to get results, you first need to convince those who make public policy. As a result, what I recommend is that you do both things at the same time when it comes to public policy, work untiringly to show results, to show that you can change reality. And that is one way to gain political support and make sure that nursing enjoys a consensus. No matter what political discussions are underway, health and education have to be state policies. I'd like to take the last minute I have to tell you a story because it has to do with a special type of gratitude during the pandemic. We trained nurses, male and female, and we trained instructors to be able to change the way virtual education is provided. These are teachers who have continued teaching their students throughout the pandemic. We were working online. There's a province in the north, close to Bolivia, which has communities who live at 4,000 feet in altitude. We had a teacher who said she was having connectivity issues, so she was speaking to us from the street. She had traveled an hour by motorcycle in the cold to carry an arm, which is used for biosimulation. And following her example, we now have a slogan, which is never less than her. So as public policy makers, we need to support the huge effort of leaders, teachers, and students during the pandemic to stay on track with their studies, to graduate, and to give the country what it needed, more nurses, male and female. We've always spoken as nursing as the front line against COVID. Little is said about what the nursing schools did in that context, so I want to pay tribute to them right here and now. So congratulations to all, and we will continue to fight for more and better nurses. Thank you very much.
Excelente presentação.
Excellent presentation.
Thank you, Gabriel, for telling us what Argentina is doing to increase the number and quality of the nursing professionals. Now it's my honor and pleasure to invite one nurse, a nurse from a primary healthcare service in Colombia, to tell us her experience. So Valentina James Vargas de Colombia, por favor, Valentina.
Please, Valentina. Valentina is going to tell us about the role of nurses in populations living in conditions of vulnerability.
Thank you. Buenas tardes para todos.
Good afternoon, everyone. First of all, I wanted to thank the Pan American Health Organization and the Johns Hopkins University, not only for inviting Latin American countries, but for inviting my country and for deciding to invite someone young from my country, someone who's currently working and who is on the ground. And it is a great honor for me to be able to be with you today. I brought you a message called Nurses, a Key Element in Primary Healthcare. And I'd like to begin clearly stating what the three major conclusions are. The first one is that being a nurse is a lesson, and it is a choice, and not only a choice, but a major professional decision. Secondly, that primary healthcare saves many more lives than hospital stays. And third, that primary healthcare must be led by communities, vulnerable communities, hand in hand with nurses all around the world. And for this, first of all, I'd like to begin by talking about my own history. I decided to become a nurse in 2016 because I had the possibility of being a volunteer in the city of Jerusalem. And I looked after children coming from the war in the Middle East as refugees, and they had congenital heart diseases, and they received their heart surgery in Israel. At that time, I was able to experience, to feel the power that care had over these children, the power of the nurses that worked there, the power of the volunteers, and the difference that it made between life and death and between the recovery of all these children. At the time, I remember that I arrived in Colombia and I told my parents and my friends, I want to become a nurse. But much to my surprise, no one liked the idea. They said, well, then become a doctor. If you like taking care of people's health and all of that, then go to medical school. And I said, no. I decided and I experienced the power of science over care, over the science of diagnosis, and I want to be a nurse. And I said that because throughout my profession, I had to deal with why not be a doctor. People have this social bias that all nurses are nurses because it was up to us to do it, because we did not have the money to become doctors, to have access to medical school, or we did not have access to medical exams. And that is not true. Many nurses decide to be nurses because we understand the power that the profession has in order to save the life of many people. Once a doctor said to me, look at this. Nurses are like the Cinderellas in health systems. They do a lot of work and they're very important, but they're always behind the shadow of other health professions. And I feel that today, celebrating the International Nursing Day, the International Nurses Day, it is high time to recall why nurses should not be the Cinderellas of health systems. We do a lot of work, but we also deserve that leadership role. We deserve to be in front of places, in front of these places where care is given. My first work was during COVID-19. I had the opportunity to be first line professionals in hospital care. And during COVID, I realized why I wanted to be involved in primary health care and not hospital care. I remember that I was living in a different city and I called my parents and I said, please don't be infected because then we won't be able to save you. I saw so many people die that I was convinced that we were not going to be able to do anything for them. And what was going to save these people were basic health care services. Use the mask, wash your hands, and confinement, mandatory sheltering at home. And I decided to follow primary care because I understood that health is a phenomenon that goes through biological things. It has political, economic, and cultural implications. I'm showing a picture of Colombia. This picture was taken during the confinement stage. At the time, the city of Bogota, many people started having red shirts on the streets, letting the government know that in that place, people were not dying of COVID, but they were dying of hunger. But in fact, if health systems were to focus on primary health care, the World Health Organization believes that we would be able to save 60 million lives and raise life expectancy by 3.7 years. The problem of primary health care, what has this problem been? Well, and I'm showing the definition. One of the definitions that the WHO uses together with UNICEF, and I'd like to stress three things out of this definition. The first one is that primary health care is an approach that brings together, that links the whole of society. Secondly, we need to achieve the highest possible level of health for all societies. And the third one, to build more equitable health systems. And that implies that we have to overcome the preventive approach in health. Preventive medicine is very important and it has saved many lives. But preventive medicine has two problems. The first one, to strengthen this so much, has left individuals, families, and communities to continue playing a passive role vis-a-vis the care. They're not empowered over their health. They simply receive the care we give them and they receive health education. The second problem is that it has also enabled nurses not to play so many leadership roles. We've been boiled down to having operational jobs such as immunizing, vaccinating, or health courses. Preventive medicine is important, obviously, but if we go back to the essence of the message in the Almata Declaration in 1978, when all these countries gathered and set as a goal to achieve the goal of health for all by the year 2000, we'll see a couple of things. The first one, primary health care, ever since then, was the proposal in order to build health through social participation. This means that it is important that the communities play an active role. Communities are vulnerable, but that does not mean that they don't have a voice and they don't have something to say and that they should not be considered within the building health programs. The second thing is that primary health care must be based on the respect for diversity, and it must ensure that people and individuals have to feel close to health systems and not impacted by them or harmed by them, but that they can feel that they can be part of them or participate in them. And they have to look for universal access to health and understanding health as a social well-being. Essentially, primary health care is betting on our care for life. Who are those the scientists of care who look after life? And therefore, we believe that nurses are the ideal professionals in order to help primary health care to go back to its essence and to find its rightful place. First of all, because by being the scientist of care, we can build together with the communities how they are going to learn to take care of themselves. Secondly, because we're famous, because we build the relations of greater proximity with individuals and families. In hospitals, nurses are those that are better, that know the patients much more. They talk to them, they get to know them better. And the third one, I'm convinced that we were born leaders. If you think of a nurse of a hospital, you look after doctors, you look after patients and the relatives and the families, you're solving administrative problems, you're managing drugs and medicines. We're always leading health systems and we're at the helm of a service. And I believe that this is the role that we must truly play. Not only the role of doing education in health and not only the operational role, but also the role, the leadership role and the role of political participation. I work for the health system in Colombia in the territorial health model, health in my neighborhood. And this territorial model was created in 2020 under Claudia Lopez, the mayor at the time. Even though there's a huge preventive approach, we've been able to build groups of work with the vulnerable communities. And I brought you two examples which are important to me. And it is the dialogue that we've established with the community LGBTQ+, and with the indigenous community present in the city of Bogota. We've sat down with them to understand, one, how they see health, how they understand health. Second, what they want from their own reality. What are the choices offered in order to solve their problems in health? And we've built the local care plans so that the communities themselves will provide the alternatives, but with the professional guidance, not only by nurses, because we have to acknowledge that primary health care is an interdisciplinary work. Together with the team of professionals, we've worked hand in hand with these communities in order to guarantee a right to health and a well-being. So this is me in my work. I'm a primary healthcare nurse and I dance with older adults on the street. I play with the children out in parks. I also work with young men and women, but I not only do this, but nurses in primary healthcare have to participate in political events, not only going to work on the ground, but also within the places where decisions are made. And also within hospitals, we can also provide primary health care. We can sit down with a relative, with a patient, and develop a care plan. And if you're going to compare me with a princess, because we're essentially a profession with mainly women, and sometimes we're placed in these female roles, if you're going to compare me with a princess, I'd rather be compared with Mulan, not only because she's my favorite princess and the favorite princess of most everybody, but because I feel that Mulan is a princess that was a key element in order to win the war. She was a calculator, intelligent, she was a leader, she knew how to manage an entire work team. And I believe that the nurses are the key element in order to be able to establish primary health care in health systems in the world because of our scientific capacity, our leadership, and our ability to give a voice to the communities in acting as a bridge between the communities and the state. It is not only a matter of saying now, it is not only the doctors who lead, but those who have to lead our communities and individuals. But nurses are a very capable profession of achieving that bridge between the state and the communities and be able to ensure that health is a right for everybody in all countries. Thank you very much.
Excellent. No? Yeah. And now we are going to continue with an excellent presentation as well. Challenges in training and ensuring decent work for nurses in the post-pandemic period. And it is my pleasure to invite Dr. Nancy Reynolds, Professor and Associate Dean of Global Affairs of the Johns Hopkins University School of Nursing. Thank you, Nancy.
Thank you so much. And it is really my honor and pleasure to be here today for this event that's really recognizing International Nurses Day of 2023. And it's been really wonderful hearing about all these examples of success. I'm going to be focusing a little bit on some of the challenges that we are facing in training and ensuring decent work for nurses in this post-pandemic era. So the COVID-19 pandemic has really exacerbated long-standing workforce challenges that continue to threaten healthcare systems around the globe. The impact of the pandemic on the nursing workforce varies somewhat by country, as we've been hearing about today. But a core group of challenges really have emerged at a global level, and many of these were present before the pandemic. We've heard a great deal from country to country about heavy workloads related to COVID-19 and care for persons with other conditions, which have increased hospitalizations and critical care needs, unsafe workloads and working conditions, fatigue and burnout, and increased attrition. In fact, one nursing organization referred to it has been a relentless, intense, and a continuing drain on nurses' energy, morale, and physical and mental health. Reports show that there are not enough nurses to meet global development goals on health, even without the global pandemic. The global nursing shortage was a well-recognized issue prior to the pandemic. In 2020, when the first State of the World's Nursing Report was released by the World Health Organization, it revealed that the global nursing workforce was about 28 million, and it was estimated that there was a shortfall of roughly 6 million nurses. The shortages now are estimated globally to be as high as 13 to 30 million. And this is really compounded by many regions and countries and sectors by an unequal distribution of nurses. The former chief executive of the National Health Service and the permanent secretary of the Department of Health of the UK, Lord Nigel Crisp, who co-chaired the Nursing Now campaign, commented at the height of the pandemic in 2020 that the biggest thing we can do for health globally is to strengthen the nursing workforce. And he said, you know, that year 2020, which is supposed to be the year of the nurse and midwife, was not the one we envisioned, but it certainly highlighted and was a powerful demonstration of why we need to support and to invest in our nursing workforce. And he commented, it will be the greatest tragedy if we do not learn the lessons from this pandemic. So what are these lessons? To name a few, first, health systems obviously were not adequately prepared or resilient. And by resilient, health system resilience, we're referring to the ability of health systems not only to prepare for shocks, but also to minimize the negative consequences of such disruptions, recover as quickly as possible, and adapt by learning lessons from the experience to become better performing and more prepared. Second lesson, COVID did not just expose the cracks in global health systems, it demonstrated how much health matters for economies. As the World Bank noted, the COVID-19 pandemic sent shock waves through the world economy and triggered the largest global economic crisis in more than a century. Oops, missed a slide. I guess not. Okay. And the third lesson, COVID highlighted and has exacerbated serious health inequities. Global poverty increased for the first time in a generation, and there's been disproportionate income losses among disadvantaged populations, which led to a dramatic rise in inequality within and across countries. And in my travels, I've witnessed this firsthand. And then a fourth lesson is that human resources for health were critical actors in the pandemic response and are imperative for the ongoing social and economic recovery and for building the resilient health systems of the future. The effectiveness of healthcare is inextricably linked to the state of the nursing profession. Nursing makes up the largest segment of the healthcare workforce and brings many strengths that we've been hearing about today that are needed, including the provision of basic and advanced specialty care in numerous types of acute care and community-based settings, the delivery of public health, school health, and home health services, and skill and compassion in caring for vulnerable populations in rural and underserved locations. Nursing was at the forefront of COVID-19 response effectiveness in all countries and is going to be critical to the success of health systems in the recovery and rebuild. Inadequate levels of nursing matter deeply because this impacts negatively on care quality and outcomes, as well as being a major constraint on any rebuild efforts. So what needs to be done? We need many immediate and long-term actions. We know what needs to be done. We've had several reports come out, the State of the World's Nursing Report, the Global Strategic Directions for Nursing and Midwifery. PAHO released a report last year on the strategic importance of national investment in nursing professions in the region of the Americas. We have the Global Strategy on Human Resources for Health. ICN just released Recover to Rebuild, and there was just the 5th Global Forum on Human Resources for Health. And they all highlight strategic action that's needed to support investment in the nurse workforce, which will enable health system rebuild and preparedness and the achievement of the Sustainable Development Goals. The importance of a competent, confident, and credentialed nurse has never been more crucial. And again, as we've been talking about, they're the backbone of the healthcare system. They comprise more than half of the skilled healthcare workforce worldwide. They have an essential role in patient safety and health outcomes. They have a key role in addressing social determinants of health and improving health and healthcare equity, and they're critical to rebuilding healthcare systems. Yet their contributions are not always valued or acknowledged. And in many settings, a robust nursing workforce and a safe healthcare system are elusive. The key issue that's been highlighted across reports are underfunding, staffing shortages, low salaries, heterogeneity in the education and preparation of nurses, and their roles and competencies are highly variable, lack of lifelong learning and career advancement opportunities, poor workplace conditions and lack of basic supplies, including personal protective equipment, and an inadequate presence in the healthcare leadership and policymaking. So what are the challenges? Why aren't we seeing the expected level of investment in the nursing workforce that we know needs to happen? We really have a big gap in our knowledge and action. And as prior reports have shown, and when the State of the World's Nursing Report was released, it was really expected that drawing on this National Health Workforce Account data and providing this evidence of the contributions that nurses have already made that are so important towards achieving sustainable development goals, it was really expected that countries would have policy dialogues in regional, at country, regional, and global levels, that there would then be evidence-based decision-making and policies for education, regulation, practice, decent work, youth inclusion, and gender equity, and ultimately investment in nursing for sustainable domestic, regional, international investments in nursing and midwifery. But some of the challenges that seem to be getting in the way, one, in relation to a response to the pandemic, that we're often holding the individual nurse responsible for his or her well-being. There's a major concern that despite high levels of nurse burnout being reported in many studies, there's often an absence of a systematic organizational and employer response, with further burden being placed on the individual nurses to be resilient. And this continued to happen as we've entered into the 4th year of the pandemic and rebuild. And there's really been a call for the organization, as opposed to the individual worker, to be held publicly accountable for the worker well-being. We've also addressed nursing shortage policies with a reliance on quick fixes. And this often includes requiring existing nurses to work longer hours, use of travel nurses, co-opting student nurses into work before they finish their education, and fast-tracking international recruits. And this is not sustainable in the long term. It may actually mask reduced supplies of longer-term and permanent nurses. And we absolutely need to be focusing our efforts on sustaining and retaining the nursing workforce. We also are having difficulties meeting the demand for quality nursing education. We know we have strong data that shows better educated nurses are associated with better health outcomes. And yet we have challenges in uniformly preparing nurses who can provide a high standard of care. In many settings, this is related to a shortage of facilities and faculty, and also a robust quality assurance framework. We also need to ensure a nursing workforce that is diverse and prepared with the knowledge and skills to address population health issues related to aging, social determinants of health, and the major increases we are seeing in mental and behavioral health. Also see big gaps in effective workforce planning. For example, we are not seeing adequate data-driven workforce planning. The evidence on the negative effects of low nurse staffing on the quality of care is almost exclusively from high-income countries in acute care settings. We see wide heterogeneity in staffing metrics across different studies. And we have challenges even in the nomenclature surrounding the professional title of nursing and much heterogeneity in educational pathways. And then we struggle with scope of practice restrictions. Obviously, nursing regulations provide the framework for safe, competent nursing practice. But regulatory restrictions placed on nurses' scope of practice limit access to care generally into the high quality of care that can be offered by advanced practice nurses. The evidence simply does not show that scope of practice restrictions improve quality of care. Rather, these regulations restrict competition and contribute to higher healthcare costs. We also see some challenges with the role of technology. Telehealth and artificial intelligence offer many exciting opportunities to facilitate access to care and potentially lighten the workload of nurses and improve management of nursing care. But with this opportunity comes risks that we need to be aware of, such as in security breaches, in security and privacy. The AI algorithms are subject to the danger of perpetuating implicit biases that are embedded in the data. There's the risk for data input poisoning for malicious purposes. And I was just hearing a report this morning that AI is growing so rapidly and very unpredictably. And it's hard to anticipate what this is going to mean for all of us. We also have a lack of a coordinated response. The aging of the population, the rising burden of chronic illnesses, climate change, and increasing health disparities are major challenges facing society. Integrated workforce strategies are needed to create a balance between population needs and the available health workforce. Further, without effective coordinated action to protect, support, and rebuild the nursing workforce, the current global shortages of nursing will continue to become even more dire. And lastly, and I think maybe most importantly, is that health and nursing continue to be widely viewed as a cost. And in this is just one example in this recent McKinsey report that was titled Prioritizing Health, a Prescription for Prosperity, highlights how better health promotes economic growth by expanding the labor force and by boosting productivity while also delivering immense social benefits. And in this report, they say that the global GDP could rise by about 12 trillion by 2040, an 8% increase based on fewer health conditions and expanded participation in the labor force. This report also says that for each $1 invested in improving health, that we could have an economic return of $2 to $4. And yet, while we know nurses are crucial to improved health outcomes, they continue to be the target of short-term cost-saving measures. So one thing that those of us who are researchers need to be doing is we need much more research that better quantifies the economic value of nursing. And while this current situation is concerning, this really is a time of opportunity. We now have a chance to reform the flawed healthcare system that made COVID-19 far more damaging than necessary. There's an urgent need for effective and coordinated policy responses, both at the national level and internationally, globally. So key areas for policy action and planning are better data to inform effective workforce planning and support, a substantial increase in the numbers, types, and distribution of the nursing workforce, the education and training of nurses, calls for revision of curricula and improvement in the training infrastructure and addressing faculty shortages, as well as improvements in nurse knowledge skills and community-based and their ability to address social determinants of health. eliminate restrictions on scope of practice and increase the use of advanced practice roles, and improve employment conditions to enhance retention and the well-being of the nurse workforce, attract new nurses to the field for better health for all and global health security. On International Day, Nurses Day 2023, we thank and celebrate nurses around the globe, but the nursing profession doesn't need token signs of appreciation. It needs substantive commitment to global, national, and local action. Nurses must be protected, respected, and viewed as invaluable by policymakers, the public, and all those who make decisions affecting the delivery and financing of healthcare. Our future depends on every nurse, every voice to not only be on the front lines of care, but also to be on the front lines of change, be it in the community or the acute care setting, as an educator, researcher, advocate, or policymaker. So to close, we have a once-in-a-generation opportunity to rethink the role of health in a post-pandemic future, making health a priority and shifting focus to areas with the highest return can improve resilience, reduce health inequality, and promote greater individual, social, and economic well-being. Without sufficient investment in well-supported nurses, there can be no effective healthcare system recovery. The nursing workforce is crucial to address complex population health needs, which calls for more community-based and primary care capacity and the need to bridge healthcare with the social factors that influences people's health and well-being. Improvements will be realized more rapidly, more uniformly, and more successfully if coordinated programmatic policy and funding opportunities are leveraged by health systems, governments, educators, and payers. So I thank you for your participation and attention.
Excellent presentations, no? So I want to invite our audience in the virtual audience to give a big applause to all the participants until now. Please give us a big applause, and you can see. Thank you, virtual audience. Thank you all, almost the 850 participants that we have in a virtual audience. So let's go to the last but not the least presentation. We have a person from the International Labor Organization. She's right now in Lima, Peru. Her name is Svetomira Radoslavov. Sorry about the big name. She's occupational safety and health specialist in the International Labor Organization. And she's she's in Lima, Peru right now. And it's a pleasure to have with us. Thank you.
Good afternoon, and thank you very much for this invitation. It is a great pleasure to add my voice to be here with you and celebrate the International Nursing Day, which is so important for our society. And I would like to share my screen now. Okay, thank you. You should be seeing it now. Oh, all right. So I wanted to talk to you today about three basic issues, which are the international labor standards, which are the most relevant for nurses. I also wanted to present findings and recommendations from the most recent reports from ILO, which are relevant for this group of professionals, and review the tools, the most recent tools from ILO in this field. So regarding international labor standards, we need to take into account Convention 149 for nurses and recommendation number 157 that goes along with it. So here we can see recommendation number 39, which is the first recommendation that the ILO adopted specifically for the nurse staff collective. This is from the year 1930. It is a document that was obsolete and it has already been removed. But what it means is that the ILO has always been interested in protecting the rights of nurses from its very inception. So another instrument which is significant is recommendation number 69, and we see that these two first international standards for labor, recommendation 39 and recommendation 69, led or said that in order to guarantee medical care, we need to guarantee appropriate working conditions for nurses and nursing professionals. And this is precisely the objective of the instruments that were adopted later, Convention 149 and Recommendation 157. Nursing as a profession is also protected by other standards, international standards. Many are applied universally to all workers, which include, of course, nurses. These conventions cover different issues. So, for example, freedom to unionize, discrimination, collective negotiations, leaves, protection during maternity, and also work site protection, safety. I wanted to focus on Convention number 149. This convention, which was approved or adopted over 50 years ago, it continues to be very relevant today because the scarcity of qualified personnel and the working conditions, less than ideal working conditions in nursing still persist, and some have even worsened, especially during the COVID pandemic, and they have, and this has been already mentioned by prior speakers. So the convention is one that covers all nurse professionals, all categories of nurses. The expert committee has clarified that this includes all kinds of nurses, regardless of their legal status as employees. The convention is also to be applied in every working place where nursing activities are carried out, hospitals, clinics, community service, and schools, homes, private homes, hospices, prisons, the armed forces, humanitarian
organization. So it really applies to any workplace where nurses are to be found. And it is also, it covers nurses both in the private and public areas, and also to volunteer nurses. There are special circumstances for volunteers who provide nursing services. So this convention emphasizes two basic issues: policies and measures that have to be taken through legislation. So regarding national policies, the convention requires that all member states adopt national policies to guarantee nursing services in the quantity and quality as are necessary to ensure that the population may have the highest level of health, also to guarantee education and training that are appropriate for those who work in nursing, and to also guarantee labor conditions that ought to be good, and also career prospect as well as remuneration should be good enough. These labor conditions should be good enough to attract and retain nursing professionals. The national policies are required to be formulated and coordinated with other health-related policies and other health professions, and always in consultation with employer and worker organizations. And this is all under the edges of the convention. Regarding national legislation, the convention provides that the legislation should include basic demands regarding training and education for nursing staff, and also reserving exercise of the nursing profession only for those who meet the requirements, and also provisions that are improved in the work site if it were necessary, and that they be adapted to the work of being a nurse, and that a series of conditions ought to be the same as other conditions of workers in other professions regarding rest, schedule, compensation for overtime, shifts, weekly rest, and remunerated vacations or leave, and also leaves for infirmity or maternity and social security. The convention also provides that measures be taken to encourage social dialogue. So it requires that there be consultation and participation by nursing professionals in decisions that affect them directly, and that there be collective bargaining regarding labor conditions as well as mechanisms for conflict resolution. Social dialogue is not only the cornerstone of this convention, but also of all international labor laws, and it is part of the DNA of the ILO. I wanted to give you an overview of where we are regarding ratifications in Latin America and the Caribbean regarding convention number 149. There's only 17% or only 17% of ratifications of the convention are in Latin America and the Caribbean. That means only 7 countries in the region. We needed to bear in mind that ratifying and implementing the convention is a means to advance in improving labor conditions for nursing staff. And I would like to take this opportunity to emphasize the importance of ratifying and implementing in law and in practice the full extent of the convention, Convention number 149, regarding the recommendation, which is recommendation number 157. It's the recommendation which was adopted at the same time as the convention. It is a recommendation that goes along, accompanies the convention, and it is an instrument which complements and develops and elaborates on the requirements established by the convention. I would like to remind you now that more recently in 2017, there was a three-party expert meeting regarding improving labor conditions among health services providers, and members in this committee ratified Convention 149, and they concluded that decent work among healthcare workers, including nurses, is essential to guarantee health systems that be effective and resilient. And in addition, that decent work is an absolute need, absolute necessity to face the persistent scarcity of qualified nursing staff and to achieve equality of access to healthcare that be quality healthcare. And now I'm going to give you an overview of the findings and recommendations made by the expert committee in implementation of conventions and recommendations by the ILO. The expert committee is a body of the ILO, and one of its functions is to publish each year a general study, which is very much in depth, devoted to a specific topic. And last year, the topic for this publication was the field of nursing, and the convention and recommendation that we have just discussed. And so I wanted to talk about the main concerns of the group of experts who reported this in their publication. This is a list which agrees with what I've been talking about, or what Ms. Reynolds talked about in her presentation. The challenges among nursing staff is the fact that there is scarcity in personnel, in nursing staff, low remuneration, very long hours, work by shifts and in schedules that are not very convenient, insufficient vacation time and rest time, insufficient coverage of Social Security, lack of opportunities for training, lack of opportunity to develop one's career, inadequate protection regarding safety and health in the workplace, lack of appropriate lodgings in certain countries, and lack of participation by nurses in policymaking. Also, the expert panel has said that the working conditions for nurses has deteriorated during COVID-19 pandemic, and they have pointed out in particular the fact that during the pandemic there has been a higher risk of exposure to the virus, of course, and there has been lack of PPE, and the working schedules and the hours have been unprecedented. The workload has been intensive and long, and there has been the need by nurses to assume certain new tasks without having had prior training for this, because there was no time to provide training.
and education to nurses, and also significantly a also physical, verbal harassment have increased as well as violence, and this increased during the pandemic as well. And all of this has led to more risk of contracting COVID, but also the death rate is higher for this profession, and it has also led to more mental health issue, anxiety, stress-related disorders, post-traumatic syndrome, stress disorder, and many more. I'd like to share some key messages from the expert commission or committee. And the expert committee tells us that member states should adopt coordinated measures. And this has also been mentioned by other speakers, and these coordinated measures should be in collaboration with social interlocutors as well as in consultation with other stakeholders. And they should be aimed at tackling the current scarcity of nurses and the future scarcity of nurses, not only locally and nationally, but also internationally. National policies should be prepared around three major axes. And they should have the following elements: planning above all, or for starters, and also education and training, as well as appropriate and decent labor conditions. Developing policies should be a continuous process, an ongoing process that can be adjusted according to changing situations, both in the health sector as well as the communities that they serve, to make a comparison regarding labor conditions that are demanded. They are based on the Deming cycle, which requires 4 phases: planning, implementing, verifying, and adjusting policies according to the context, with the idea of seeking continuous improvement. And this is a principle upon which modern management systems are based. And another key message from the expert committee is that national policies should incorporate equality of gender equality and diversity, so that there is appropriate diversity, appropriate treatment, and eliminating discrimination in the profession. The panel of experts affect women. There is direct discrimination against women. There is also indirect discrimination, sexual harassment, salary gaps, and other inequities. These measures, these gender equality and diversity and inclusion measures should have positive impact on current and future scarcity of nursing staff, because then there would be education, training, motivation, better hiring practices, better salaries, and it will eventually help to retain both women and men in the nursing sector. Key messages regarding safety and health from the panel of experts are as follows. Nursing staff should have priority for tests and vaccination. Several elements should be taken into account before having an should not come with a cost for nurse workers, and to guarantee the health and well-being of nurses should be given the maximum priority in developing health policies and health planning. I also wanted to give you a few messages or some findings that have come from this flagship report, which is called Social Perspective and Employment Perspective in the World. This report was published in March of this year, and it has to do with essential work. The main findings of this report or this research work is that there is a correlation between the the income level and the health. There is a direct correlation between income and healthcare staff. The lower the pay, the fewer the healthcare workers. And if payment is not enough, then this leads to nursing staff leaving their jobs. And so this implies a big cost for the healthcare system, and this endangers the quality of healthcare provision. There are other findings which are not surprising, but they are confirmed after this research work and based on the evidence compiled to do this research and to have the corresponding report. Nursing staff, nursing professionals had the highest rate of death, ran the highest risks during the pandemic due to biological risks and also psychosocial and mental risks. The risks are many more, but these are among the main risks.
Also, there was a higher workload, excessive overtime, and also interacting with people that were severely ill. All of this contributed to an increase in psychosocial risks. And then a concrete piece of information we get from your report is that between February and July 2020, there was a 50% increase in violence against healthcare staff, according to the International Red Cross. As an aside, according to WHO, ILO estimates from 2021, which are the first joint estimations between these two organizations, show that the risk factor because of highest number of deaths at work was excessive working hours during the day. Now, in terms of recommendations and proposals, well, of course, policies is one of the biggest recommendations stemming from the report, but the report also emphasizes the importance of investing in healthcare and long-term care. And it also says that investment is costly, but they're worth it. According to the report, we need an increase in investment to reach SDSs will create 173 million jobs. There was also a legal review for health and safety at work that pointed to several proposals, and it said that it's important to adopt standards related to biological risk and airborne transmissions. This is a gap that we have both at the international level as well as at the national level. We also need to allocate resources to work inspections. This is a persisting issue. Also, we should clarify the right for workers to leave a workplace that would cause imminent and serious damage. And ideally, COVID-19 should be classified as a professional disease. There should be universal coverage by law for all healthcare workers, even those who are not regular full-time employees. And of course, we should ensure bipartisan and three-way coordination agreements. Now, to conclude, I would like to briefly talk about recent progress in terms of health and safety at work for nursing staff. I wanted to talk about this not only because it's my area of work, but also because some very significant progress has been made. And I'm talking about the landmark decision that was made by governments, legislators, and workers last year at the ILO conference when it was decided to include a health and safe workplace as part of some of the fundamental rights and benefits at work. These refer to Conventions 155 and 187 regarding health and safety at work. And as a result of this, all member states of the ILO, regardless of whether or not they ratified the conventions, now have taken on a commitment automatically just by virtue of being members of the ILO to protect and respect fundamental rights that are enshrined in these conventions. These conventions are to be implemented universally, that is to say to all workers, which of course includes nurses as well. In terms of recent tools, here I have a series of the most recent tools we have. We adopted guidelines on economic risk. There was a collaboration between the ILO and the International Ergonomics Association. We also adopted a guideline for occupational work and safety for healthcare workers. This is a joint guide between the WHO and ILO. Also, technical guidelines were adopted for biological risk at work. That was happening in 2022. And then by 2025, it is expected that an international standard will be adopted on biological risk. Again, in terms of ratifying, in our region, the rate is very low. You can see that globally speaking, we don't have very high ratification levels, but those levels are even lower in our region. And if we see the breakdown of these ratifications, we can see that in terms of Convention 155, the Latin American, the Caribbean region ranks right around the middle, whereas for Convention 187, it lags farther behind. Let us remember that in Latin America and the Caribbean, we have two ratifications for 155 and just 5 for 187. I couldn't conclude without a call to action to ratify, implement, and enforce these fundamental conventions because the life, health, and safety of all workers, including, of course, nurses, should be our top priority. Thank you very much.
Thank you so much for your presentation, a very excellent presentation as well. And we are almost finishing the meeting. I would like to invite the Unity Chief, the Chief of the Unity Human Resource for Health, Dr. Benjamin Puertas, to give his closing remarks. And after that, we are going to call our colleague Nancy Reynolds from Johns Hopkins. Dr. Benjamin, por favor.
Thank you very much, Sylvia, and thank you very much, colleagues from Johns Hopkins University. Thank you very much, my colleagues from the Pan American Health Organization, and to the 800 and so friends, nurses, and and participants that have been there virtually, sharing with us a celebration. And perhaps we're a little bit serious now, but let's keep remembering that this is a celebration today. And what a journey today. We have heard countries from South America to share their experiences on nursing, but not only experiences, but also their challenges. We see a country as Brazil that is now beginning to bring back many successes that they achieved in the past, new challenges as well. We can see Argentina and the way they are moving from back to a decade, and the results by investing, by working in advocacy, by working in policy development together with the government, not one government, but 3 governments of different ideologies. We have heard perhaps the most passionate presentation from Valentina and Colombia. And what I take from that presentation is the way that sometimes we need to present facts and evidence and experiences to our colleagues. Sometimes we are very, again, serious and politically correct when we speak to audiences such as this. But I think we need more of what Valentina showed to us today. I learned a way to present primary care definition, not from a perspective of only Alma-Ata and what the books and the articles and the journals say. Today, I learned to talk about primary health care from a perspective of a local worker, doing what she loves, and doing what most of you and all of we who are in this room love. Because we talk about love with Gabriel recently today, because nursing is about that, love. And he agreed, you know, when we talk about nursing, he's a physician, but he is the head of the nursing program, the one that you heard in training in Argentina. And somebody at the table asked him, why, being a physician, you are head of this particular program in Argentina? And he said, because I love it. And I receive a lot of criticism, yes, because I'm a physician. And you know, I'm a physician from Ecuador, and I know exactly what the difference and sometimes challenges we have when we talk to each other. But here we are. So that's a wonderful experience. And I wanted to share that because probably you didn't know, because he didn't tell us that little small detail, big detail. Because that also means that we can talk to each other in that way. We need to understand that eventually we want to see a nurse as a Minister of Health. And physicians shouldn't have anything to say about, but to congratulate that government that appointed a minister who is a nurse, or any other category of healthcare professional. So I want to be passionate today, because we have already gone through a process of listening to experiences from Argentina, Brazil, Colombia, the International Labor Organization, and the policies and norms and regulations about nursing. I want to be passionate because Valentina mentioned the word power of nursing. Gabriel mentioned the love of nursing, being a physician. Brazil, looking to the future, is looking to the future with a lot of hope. And everybody in this room is hoping that nursing takes that position of leadership in the world, the position that it deserves. I want to be passionate too because I'm passionate because I'm a musician as well. And I know that afterwards, Nancy will present some important way to close a celebration such as this. And that's art. So, and that goes very much and very well together. So I want to make sure that we understand the roles and the challenges. Although we are celebrating, we're also thinking and rethinking the role of nursing. We were talking about expanding the role of nurses. We were talking about the lessons learned during the pandemic, lessons that we cannot forget. Can you imagine, in this country, we just read in the news the end of the pandemic, you know, as it was. And so what is going to happen with the healthcare or health workforce in the future? Does it mean that it will end here and we move into a next step without taking into considerations all the experiences and suffering in many cases that all of us, nurses, physicians, technicians, and decision makers have gone through during the pandemic. We cannot forget. So this is a celebration to be happy, to be passionate, to love, to be empowered, but also to remember that we cannot forget. And we cannot let our decision makers forget about it. Investment. It's very easy now, you know, the pandemic is over. Most of the countries have finished their emergency situations, but it doesn't mean that they need to forget about the needs. All that we saw here, they are there. The challenges with the health workforce were before the pandemic just exacerbate them. As a head of the Unit of Human Resources for Health at the Pan American Health Organization, I'm here to remember, to use that experience to move forward, to be able to engage countries, to share their experiences with those countries that are less fortunate or less developed, to be able to learn from each other, and to be able to bring nursing, medicine, and other healthcare professionals into the place they deserve. I recently finished my duty in the Caribbean about 3 months ago, and I was based in Barbados. Yes, I have to say that I came to Washington in the middle of winter, and that was very hard coming from an island like Barbados, but here I am. But something that I learned to understand is the importance of nursing and the way that the whole region of the Caribbean deals with nursing as a whole. They have a regional nursing body. They have a whole, just one curriculum, as Nancy Reynolds and other people were talking about, the importance of having a common curriculum. I think Gabriel also mentioned. And the way they deal with registration of nursing, but also I learned of the challenges with migration of nurses in particular. And I was amazed to see countries such as Grenada and the number of nurses who are leaving the country and being taken by more developed countries, including the USA, and how we can mitigate those challenges in those countries that are giving and letting go in a brain drain their professionals. So we have, yes, many, many challenges, and I'm here to remember those, to don't let them forget. So I'm very happy to be here. I have to put myself again in a mood of celebration. And the best way to celebrate is to see the opportunities that we have by working together, by learning from each other. So I congratulate the nurses in this day, in your day. I show my respect to your work, and I hope that from the Pan American Health Organization perspective, we will be able to work together with you in the next challenges that I'm sure we will have in the future. So thank you very much, and again, congratulations.
So let's applaud all the nurses in the region of the America. Big applause to all of them. To conclude, please, Nancy Reynolds, would you come here, please?
Thank you. And I would just like to thank you, Dr. Cassiani, for all of the leadership you provide at PAHO to nurses in the Americas. It's much appreciated. And I also thank many people who are in the background today who really helped to make this day possible. Our team at the Center for Global Initiatives, our IT team, our translators, the technicians. So it's much appreciated. But we wanted to end today on a little bit of note of fun. And, you know, as I was talking about earlier today, we know that artificial intelligence is something that is, you know, becoming very prominent in this post-pandemic period. And it's sort of an exciting time for new innovations. And in healthcare, AI is being used to assist and improve patients' experiences from small tasks such as appointment scheduling and data entry to larger functionality such as disease diagnosis and treatment and outcomes. And we're also starting to see it used more and more in our everyday lives for a broad range of tasks from travel planning into writing poems. So today, for this celebration of International Nurses Day, we wanted to close by sharing a poem that's dedicated to nurses worldwide, but it was written by ChatGPT. So we'll see what it has to say about nurses. And we've invited 3 wonderful students here from Johns Hopkins to come up and give the poem in different languages. So I'd like to invite them each to come up. And these poems will be read in Spanish, Portuguese, and English by Kayla Henry, Zachary Shank, and one of our fabulous visiting scholars from Brazil, Julia Fernandez. So I've asked each of them to introduce themselves and tell you a little bit about themselves and then read their poems. So I guess we'll start with you, Zachary. Thanks.
Thank you very much. It's an honor to be here. And I just want to say a huge thank you to everybody who's presented here today. Thank you, Dr. Reynolds. My name is Zachary Shank. I am a Master's of Science in Nursing program about to be graduate. I will be graduating in about 2 weeks and working across the street later this year in a ICU step down. So really excited about that. Thank you so much. Before I came to Johns Hopkins, I was also a Peace Corps volunteer. I served in Peru for 2 years, and so that helped me improve my Spanish. So I'm going to be reading the poem in Spanish today to you. Las enfermeras son el corazón y el alma de cada función médica. Son quienes curan y cuidan y elevan nuestro espíritu de la desesperación. Con manos delicadas y palabras reconfortantes, nos ayudan a superar el dolor y los dolores. Sostienen nuestras manos y secan nuestras lágrimas, y nos ayudan a enfrentar nuestros mayores temores. Trabajan a todas horas, día y noche, con empatía y gracia a la vista. Su cuidado y amabilidad no tienen fin, mientras apoyan tanto a enemigos como a amigos, desde recién nacidos hasta los de tercera edad. Trabajan con habilidad, con amor, con pasión, para ayudarnos a sanar, hacernos completos y hacernos sentir que no estamos solos. Así que brindemos por las enfermeras de aquí y de allá, que tocan nuestros corazones y nos ayudan a avanzar a través de los momentos difíciles de la vida, altos y bajos. Ustedes son los héroes que todos conocemos. Gracias.
Hi, everyone. Good afternoon. I'm going to introduce myself in Portuguese. Oi, todo mundo.
Hello, everyone. Good afternoon. I'm Julie. I study here at Johns Hopkins at the nursing school, and I participate in the research program. It is an honor to represent my counselor, Professor Andrea Bernardes from the Ribeirão Preto and São Paulo universities. Nurses are the heart and soul of every medical situation. They raise our spirits and our hopes. With gentle hands and comforting words, they help us go through pain and suffering. They hold our hands and dry our tears and help us go through our greatest fears. They work every hour, night and day with empathy and grace. Their care and goodness are endless. They support enemies and friends, from the youngest to the oldest. They work with love and anger to help us become better and help us feel that we're not alone. Here, to the nurses from near and far who touch our hearts, who help us through the ups and downs of life, you are our heroes that we all know. Thank you very much.
Hello, everyone. My name is Kayla Henry, and I'm with Zachary. I'll be graduating 2 weeks. So upon graduation, I'll be working at Sinai Hospital in the emergency room located in Baltimore, Maryland. Before coming here, I got my bachelor's in health administration and public health from the University of North Carolina at Charlotte. And I will be reading the poem in English. Nurses are the heart and soul of every medical role. They are the ones who heal and care and lift our spirits from despair. With gentle hands and soothing words, they help us through the pain and hurts. They hold our hands and wipe our tears and help us face our biggest fears. They work all hours, day and night, with empathy and grace in sight. Their care and kindness never end as they support both foe and friend. From newborn babes to those in age, they work with skill, with love, with rage, to help us heal, to make us whole, and make us feel we're not alone. So here's to nurses far and wide who touch our hearts and help us stride. Through life's tough moments, highs and lows, you are the heroes we all know. Thank you. Thank you all so much. You're our hope for the future.
Thank you all. Thank you for our participants, virtual participants, our audience here, the School of Nursing, Johns Hopkins University, to have us, all of us here with the translators. Thank you so much. Our PAHO colleagues, Oristela, Marie, Bruna, Giselle, Benjamin, our chief. Thank you for coming with us and to be with us and all the speakers of this event. Happy International Nurses Day. With this, we finish the event. Thank you all.